Hello, my name is Claire Kittner. I am a physician assistant in the Dumoulis Center for Cardiac Arrhythmias at Massachusetts General Hospital. You were referred to the Cardiac Arrhythmias service because you have an abnormal heart rhythm. Many times, these abnormal heart rhythms can be fixed with an ablation procedure. This video will outline the necessary steps you need to take before you come into the hospital for your scheduled ablation procedure, as well as what to expect before and after. First, lab testing and a chest X-ray should be completed within 30 days prior to your procedure. We prefer these to be completed at least 1 to 2 weeks prior to the procedure. This way, if there are any abnormalities, we have time to address them beforehand and repeat testing. These labs and imaging studies will be ordered by a provider to be completed at an MGB facility. One of our team members will call you before your procedure to outline all of the necessary steps to this testing. Some physicians also require a CT scan and/or an MRI of the pulmonary veins or other cardiac testing prior to an ablation. If your physician has recommended these studies, our team will notify you and will reach out to schedule these for you. You will receive a call from one of our nurses the day before your procedure to specifically review medications to hold, what time to come into the hospital, and where to check in. Please note, if you use Patient Gateway, the time associated with your procedure may not be accurate. Additionally, if you have an allergy to contrast dye, you should notify your doctor before your procedure, as you may need to be pre-medicated to avoid a reaction. The day before your procedure, you will need to stop eating solid food as early as 10 p.m. You can only drink clear liquids up until 1 hour prior to arriving to the hospital. Clear liquids include Gatorade, Powerade, Pedialyte, apple juice, cranberry juice, grape juice, water, regular or diet soda, black coffee, or tea. Do not drink milk, cream, or non-dairy creamer. Your procedure could risk getting canceled if you have solid food or non-clear liquids in your system. If you're a diabetic, drinking a clear liquid with sugar up until 1 hour before you arrive to the hospital is important to avoid low blood sugar. If you are on a blood thinner for atrial fibrillation or atrial flutter, it is important that you have not missed any doses in the 30 days leading up to your ablation. This includes apixaban or Eliquis, rivaroxaban or Xarelto, dabigatran or Pradaxa, or warfarin or Coumadin. It's also important to mention that you won't be able to hold any doses of your blood thinner 3 months after your ablation. Please let your doctor know immediately if you have missed any doses of your blood thinner or if you know you'll need to hold any doses of your blood thinner in the 3 months afterwards. For example, if you have another surgical procedure planned that requires holding doses. If you are not already on a blood thinner and you're having an ablation done for supraventricular tachycardia, or SVT, you may be started on a blood thinner, such as aspirin or Eliquis, for a short period of time after your procedure. This is to prevent blood clots from forming in the heart. If you are on warfarin or Coumadin, please have an INR level checked once a week for 3 weeks prior to the procedure, as well as once a week the 4 weeks afterwards, to ensure your levels have remained therapeutic. If you have your INRs checked at an outside facility, please bring in a printed copy of your INR levels when you present to the hospital for your procedure. If you are taking canagliflozin or Invokana, dapagliflozin or Farxiga, or empagliflozin or Jardiance, please hold 3 days before your scheduled procedure. If you are taking erdagliflozin or Steglatro, it should be held 4 days prior to your procedure. If you are taking a GLP-1 agonist, such as semaglutide or Ozempic or Wegovy, exenatide ER or Bydureon, dulaglutide or Trulicity, albaglutide or Tanzium, or tirzepatide or Mounjaro, it should be held for 1 week prior to your procedure. It is also important to notify your endocrinologist about the need for holding these medications 1 week prior to your procedure so they are aware. If your doctor has instructed you to hold any other medications prior to the procedure, please do so as well. Antiarrhythmic medications are usually held for several doses leading up to your ablation to increase the chances of being able to successfully induce or trigger your arrhythmia during your procedure. Other medications that can interact with anesthesia are also typically held the morning of your procedure, like blood pressure medications, diuretics or water pills, and medications that affect your heart rate. If you need to hold any additional medications the morning of the procedure, our team will let you know when we call you the day before. On the morning of your procedure, when you arrive to the hospital, you will meet with an anesthesiologist or CRNA to discuss your history with anesthesia and sedating medications, your allergies, and your history with intubation. Most ablation procedures for atrial fibrillation and atrial flutter are performed under general anesthesia, meaning you will be asleep during the procedure and you will have a breathing tube to support your airway. During these procedures, an anesthesiologist or CRNA will be next to you during the procedure to monitor your blood pressure, your heart rate, and your breathing pattern. Other ablations are sometimes performed under conscious sedation, meaning you will receive sedating medication through an IV to make you groggy, but you will not have a breathing tube because you will be able to breathe on your own. You will also meet with the physician performing your procedure, as well as the assisting fellow, PA, or nurse practitioner. You will sign a formal consent form after discussing the risks of the procedure and meeting with your entire care team. The risks of an ablation procedure are very rare, however, they are important to review. An ablation is done using thin tubes called catheters, which are inserted through the veins or arteries in the groin up into the heart. Possible complications can occur where these catheters are inserted, including injury or damage to the blood vessels, bleeding, or infection. Once inside the heart, sensors located at the tips of the catheters give information about your electrical signals. These catheters then emit heat or cold energy to create tiny scars in the heart tissue to block irregular electrical signals and to restore a normal heartbeat. Damage can occur to neighboring structures in the heart when these scars are created. This includes damage to the heart's normal conduction system, causing a slow heartbeat to the point where a permanent pacemaker may be required, damage to the veins that carry blood between the heart and the lungs, and damage to the esophagus if your procedure is performed along the back wall of the left upper chamber of the heart, as the esophagus sits right behind this area. This specific complication is called an atrial esophageal fistula, which refers to an abnormal connection between the esophagus and the back wall of the heart due to heat. You will be prescribed a high dose of a medication called omeprazole or Prilosec for a total of 6 weeks to protect the esophagus in these specific cases. At the same time, saline fluid is released from the tip of the catheters to avoid overheating the tissue. A total of 1 to 2 liters of this saline fluid is often given during the procedure, and patients with abnormal kidney function or who have low pumping function in their heart are at a higher risk of retaining this extra fluid. You will be required to weigh yourself on a scale the morning of your procedure as well as the morning after. If your weight is more than 5 pounds up the day after your procedure, or if you have noticeable signs or symptoms of fluid retention such as swelling in the hands or feet, bloating in the abdomen, or shortness of breath, you may be required to take a diuretic or a water pill to rid your body of this extra fluid. If you are already taking a diuretic such as furosemide or Lasix, hydrochlorothiazide or chlorthalidone, you may be required to take more than your usual home dose for a few days. Additional procedural complications that can occur include chest discomfort that is worse with deep breaths, though this is often only over a few days, stroke, heart attack, damage to the kidneys if contrast dye is used, new arrhythmias, and death in extremely rare cases. It's important to mention that each of these risks are very rare, and your care team is well equipped to address any potential complication that may occur. Many patients are discharged the same day as their procedure, depending on the time their case is finished, how long the procedure took and what they found during the procedure, and how you feel after the procedure. If you meet our criteria for a safe discharge, you may be sent home the same day. Otherwise, you will be kept overnight for monitoring and likely discharged the following day. It's important to mention that under no circumstance can you drive yourself to the hospital for your procedure. Because you will be receiving anesthesia, you will not be able to drive for 48 hours after the procedure. This is also to protect your incision sites to avoid putting pressure on the groin. Regarding travel after your procedure, this will be up to your doctor based on your particular case. If you have planned travel shortly after your procedure, please let your doctor know beforehand. Generally speaking, travel is permitted after a week or so as long as you can abide to activity restrictions, which will be reviewed with you. For 7 to 10 days following your procedure, you cannot lift anything heavier than 5 to 10 pounds, and you must avoid repetitive motions that put pressure on the groins, such as biking, running, golfing, and swimming. A separate video discusses all of the restrictions you will need to follow after your procedure. If you go home the same day as your procedure, you must have an adult who will escort you home after the procedure. You will also need to have an adult stay at home with you overnight. This person will also need to be available to review your discharge instructions in person, as you will just be waking up from surgery. A physician assistant or nurse practitioner from our team will see you prior to your discharge and will review all of your medications as well as any new prescriptions that you might need. If you do end up staying overnight in the hospital, you will usually be discharged the next morning. If you are discharged the same day, someone from your doctor's office will call you the following day to check in and see how you're feeling. They will ask about your groin sites, your prescriptions, your weight, and can answer any questions that you may have. You will then have a follow-up visit with your doctor or their advanced practice provider in the office in 6 to 12 weeks. If you have any general questions, you may call the office at 617-724-4500 between the hours of 8:30 a.m. and 4 p.m., or you can send a message through Patient Gateway. Please note, we do not check patient messages overnight or on weekends.